This has been great, yeah.
Go ahead.
Right. Hi, my name is Dorothy, and I just had a treatment with the QRS. I am disabled veteran, as well as I have scoliosis, which is a huge back pain problem. I just went through the treatment, sat probably for about 10 minutes. I was having a lot of pain in my lower back after standing for quite some time, which a person with scoliosis knows that you can't stand or sit for very long. And just after that few minutes, my lower back, where I was having the most pain from standing, seems to be completely gone. I mean, I was lifting up my legs and moving and twisting where I could not do that before, and it's remarkable. I'm also a disabled veteran that have had several different treatments, everything except for surgery, and then I have been told to get as much treatment outside of surgery as I can to maintain myself, and this is one of the keys and tools right here that I think that I want to pursue and continue to do in order to keep my maintenance and my stability up, not only with my back pain, but with other pain that I have in my body as well, such as fibromyalgia, arthritis, as well as knee pain that I've had that I want to eliminate. And I think that the QRS system will definitely do that. Just from this few minutes of relieving the pain in my lower back, I'm excited to see what else it's going to do in the rest of my body. Thank you.
Wow.
Yeah, that.
Do that bend down like that.
Oh yeah, that. Yeah, I'm telling you, because I wasn't able to do that. That's why I stand so much, because I have just as much pain standing as I do sitting, and once I'm up, I'm up. So, but when I sit, especially if the chair is not comfortable, then when I'm sitting, I have even more so pain to where I can't bend over. And while I was sitting there, I was testing to see how well I was doing by being able to bend over, and if I felt any pain. And by me being able to bend over and do this now without, you know, because, oh yeah, it's on this bone. If I could actually put my finger on this bone right
stretched. That means narrow and bent. The result is an effective and greatly improved closing of the urethra.
Fix this, I'm fixed. If it doesn't help this part here, then it doesn't help anything.
Wow.
So, and that allows you to be able to do this and do that. If you can't, for me, that's why I didn't do the Zumba over there, because I couldn't do the twisting and stuff like they were doing over there because it hurts too much, especially after standing. Yeah. This is the key. If I can do this, because without being able to do this, that means sitting, standing. Yeah, that's why I was asking, how long is this going to last? You know, just these 10 minutes, how long is this going to last? Because I want to take full advantage of this now. Go home and do laundry and you know, iron that I haven't been able to do for a while, you know, so. Yeah. Without Vicodin, Flexeril, my 2 favorite pain meds. Yeah. Yeah, I don't take them though. I have a lifetime prescription, but I don't take them. It makes you loopy, you know, you can't function. Yeah, this is great.
Wow.
Well, you know what? Because of my condition and what I've been through, the VA normally takes care of all of my needs in this area. So I just need to go and let my VA rep know that this is what I need, and they'll order it and get it for me.
Wow.
So.
All right, sounds good.
Okay.
Thanks.
Yeah, because this is something that anything that's going to help other veterans as well. And they always like guinea pigs, you know, and I'm always a guinea pig. You know, if it works on Dorothy, then it'll work on anybody. You know, so, yeah. This is good. That's why I say, is this going to last long? So I need to go home now.
All right.
So I can do all my household chores now. Well, gosh, yes. I know so many. I've been in the pain management clinic through the VA. That's a month-long program where I've been there for a whole month going through pain management. Some of the people that are there are drug addicted to the pain meds. And once you go through that, there's really no alternative to deal with the pain other than the medication and physical therapy. And I've had all of that, and so I've just been basically living with the pain. And you do what you have to do to get through the day, but then when you get to the point where you can't function anymore, then you have to resort to the medication to mask the pain. I want the pain to go away, period. And this, just for that, I want to know, how long is this going to last? Is this going to give me at least a day's worth, you know, that I can go home now and, you know, do some things? Yeah. Let me just say this, too, in terms of what the VA would do and how they operate. Physical therapy is one of the keys to help you to maintain. If you're in pain, you can't do exercise. And that's one of the things that the physical therapists don't quite get, is that if you're in pain, I was in no shape to exercise. You got to first be in shape to exercise. And that means you have to have pain gone before you can exercise. Everybody tells you to exercise to stay in shape, but you got to be in shape to exercise. And that was one of the things that I learned through Al Vilsanik in Boston, who was the physical therapist that helped me there, was that he had to get me in shape to be able to exercise. And then to have something to maintain that and to eliminate the pain. That's what the QRS can do. Yeah. All right. Got enough? Got enough? Now you can do, yeah, and this will be good for the VA, because this will help the other soldiers and other airmen, people coming out of, to know that you can get rid of pain without having to use the drugs. Yeah.
Wow.
Yeah, goal-oriented.
You're like phenomenal.
Yeah, this is, you know, because I was like, okay, if this helps my lower back, because this is always my test point for anything, chiropractic treatment, physical therapy. If it doesn't help this area, I don't care about the other parts of my body, because this is my area here where I have to move. This affects you if you got to twist, if you got to turn. I can't do any exercise, nothing where my body has got to be twisting and turning. One, scoliosis, and two, if your muscles aren't loose enough to be able to move, and now being diagnosed as borderline osteoporosis. So I'm very scared about doing anything that may, you know, cause me to have a fracture or something. So, yeah, I'm sold.
Thanks.
I'm sold, yeah. I said, now I can slouch. I couldn't slouch before because it hurt too much. Now I can slouch. It feels good to slouch.
Feels good to slouch?
It feels good to slouch. Because you're not in pain. It feels good to slouch. Now you know that that's bad when you say it feels good to slouch, because you're supposed to have good posture. I don't have to worry about good posture, because when you're frozen like this.
Right. Comes in. You normally couldn't do that?
No.
Really? Just couldn't bend over like that?
Yeah, oh no. He tells you, I've got all kind of gadgets and stuff at home. If I drop something on the floor, I cannot pick it up. I've got these tools that help me to pick up stuff from the floor that I drop. I'm serious.
Really?
Yeah. And Mother does a lot of my picking up, because she's short. So if I need something like from underneath the table or stuff, then she can pull it out for me, because
Really?
she's short. Yeah.
Let's see that again.
Yeah, that's what Mother helps me with. This is what I'm talking about.
Wow.
I need to have my husband.
He hasn't seen you do that?
And he's always on my case, because when I do it, it's kind of hard to describe, because if I can get over, somebody's got to help me back up. And this is a key. Even praying, because I pray a lot. On my knees. When I'm praying, when I'm ready to get up, my husband's literally got to help me get up to my stand up. And then we go in stages. You know, I'm like here, and then I get up to this part, and then, you know, slowly I gotta raise up. He can tell you.
Wow.
He can tell you. This ain't no lie. He can tell you. That's why I wanted him to come, so he could see.
Oh, what you're doing now?
Yeah, what I'm doing now. Because he knows what I felt like when I left this morning.
Really?
And I was like, he said, you're going to be there? You're going to be able to do this all day by yourself? I said, well, you know, I don't have a choice.
Right.
You know, so. And then next week, Monday, all next week at the BX, I'm going to be doing the same thing there.
Wow.
So that's why I said, how long does this last? Is this going to last a week? Because I need a week. Yeah, you know.